everyone. Today we are going to be discussing on what they didn't tell you about diabetes mellitus. Hi, my name is Romanus Amarachi Merit. I'm your nurse, midwife, reproductive health practitioner. So today I'm going to be discussing on what they didn't tell you about diabetes mellitus. I know majority of people know that diabetes is an increase in the blood sugar level, fine, but that's not the end of the story. That is not the end of the story. There are a lot of things you don't know about diabetes mellitus, and today I, Nurse Merit, I'm going to be bringing it to you. So stay tuned and don't touch that dial. Be right back. Okay, today we'll be doing this section 1 of this program. So we'll be dealing on the types of diabetes. We have different types of diabetes, but we'll deal majorly on 2 types of diabetes. The type 1 and the type 2. The type 2 will be in section 2. So today we are dealing on type 1 diabetes. What exactly is this type 1 diabetes? It is also called the insulin-dependent diabetes mellitus. It was formerly called juvenile diabetes mellitus, but we no longer call it that again. So what exactly is this type 1 diabetes mellitus? Type 1 diabetes mellitus is an autoimmune condition whereby the body's immune system attack and destroy the insulin producing beta cells of the pancreas, resulting to little or no insulin production. How does this occur? This is when the body immune system attacks the beta cells of the pancreas, destroying them and affecting the production of insulin, which will affect the whole body system, meaning that when there is blood glucose, there is nothing to break it, there's nothing to allow cells to absorb it, there's nothing to tell the liver that it needs to convert this to glycogen for storage. Points to note, when the beta cells of the pancreas are destroyed, it leads to little or no insulin production. Right. And remember that this begins from childhood, which gave it the former name that it had, juvenile diabetes mellitus, but we don't longer call it juvenile diabetes mellitus again. This tells you that it starts from your childhood or adolescent stage and extends to adult stage. And in this type, we focus more on insulin because there is not enough insulin production, so you have to replace, you have to give insulin in order to make sure that the body gets the glucose it needs, and there is also storage of excess. Okay,